Yes, indeed, our health, our life is in our hands, and to make it better, we need to work together. What a pleasant way to welcome you to another informative and educative edition of the program Roadway to Health, an hour-long program brought to you by the Ministry of Health, of course, designed to educate, inform, and empower you about health-related matters. Today is Tuesday, May 5th, 2026, and driving you through this edition of the program are Angeli, Noah, and
Hello, darling.
so, however way you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always good to be here with you. For those of you joining through the ministry's official Facebook page, I'd like to encourage you, as always, to like and share the live. Also, remember to leave comments, recommendations, where we will be able to pick up your comments, your recommendations, your questions, and to have it read to our guests. And to our radio listeners, you can also share with your friends, increase the volume of your radio so that they have access to health information as well. I would like to take a moment this morning to send special greetings to the Minister of Health, Dr. Louis and Porter, her able deputies, assistant ministers, and all of the staff at the Ministry of Health. We'd like to say thanks in a special way for your continued commitment to shaping the health agenda of our country. This morning, of course, today is May 5th, as stated previously, and today marks the World Hand Hygiene Day, annually celebrated on May 5th. So, just give you a little summary of what this World Hand Hygiene Day is. So, World Hand Hygiene Day was established and set aside in 2009 by the World Health Organization as part of its Clean Care, its Safer Care campaign under the broader WHO Patient Safety Program. It's often celebrated, as stated previously, on May 5th of each year, and it aims to raise global awareness about the importance of hand hygiene in preventing infections. And that's exactly what we are here to do this morning, bring you education, information, and empower you to make informed health choices. But before we deepen our discussion this morning, we will firstly follow the tradition of our program by bringing you development updates from the Ministry of Health official Facebook page. As I say always, there are not being done by the Ministry of Health, and you can always have access to these different health developments by visiting the ministry's official Facebook page and that of the website. But we'll bring you summary of what's happening this morning for our radio listeners. For those of you who have smartphone, you can always visit the website, the Facebook page to get access to information. So with John Bendu Dolly to bring us our developments update this morning. Good morning, Bendu.
Good morning, Angela, Noah, and good morning to our senior guests. Good morning to our wonderful listeners, those that are listening via radio or on Facebook. So, in our recent development, Dr. Louis Poto attended the World Bank Group's Regional Health, Nutrition, and Population Strategy for West and Central Africa. May 4th, Ghana, Accra, Liberia's Minister of Health, Dr. Louis Poto, and Minister of Finance and Development Planning, Honorable Augustine K. Kafan, joined global health leaders at the official launch of the World Bank Group's Regional Health, Nutrition, and Population Strategy for West and Central Africa. This high-level health and economic strategy event brought together senior government officials from across West and Central Africa, along with development partners, health practitioners, private, private sector representatives, and civil society organizations. The gathering aimed to build a shared understanding of how to advance health goals in a context of tightening fiscal space and declining external assistance. The initiative emphasizes the need for stronger collaboration and increased financing for health, nutrition, and system resilience across the region. It also highlights the critical role of the private sector in supporting sustainable and health outcomes. And the Minister of Health, Dr. Louis Mpoto, also served as panelist at the launch of the World Group's Regional Health, Nutrition, and Population Strategy. This also is a boost to the Health Ministry of Liberia. In our development as part of the Minister all hands on ground, all hands on ground on deck to end the preventable maternal and newborn death, JJ Dawson Hospital hosts dinner to celebrate staff for zero maternal deaths. Harper, Maryland County, May 3rd, 2026. The administration of JJ Dawson Hospital in Maryland County has hosted a congratulatory dinner in honor of the maternity award and supporting units following the achievement of zero maternal deaths for 2026 January to date. The event recognized the dedication, teamwork, and commitment of healthcare workers who have contributed to improving maternal health outcomes at the facility. This is a statement that all boots on ground, hands on deck to end preventable maternal and newborn health. Also on the ministry page, on our recent development, MOH partners launched Community Health Workforce Development Program. Monrovia, Liberia, 1st May 2026. The Ministry of Health of Liberia, in partnership with Mastercard Foundation and UNICEF Liberia, has launched the Community Health Workforce Development Program, a flagship initiative aimed at strengthening the country's primary health care system while creating employment opportunities for young people. The project is designed to support and strengthen community health platforms across the country by investing in a new generation of trained and empowered frontline health workers. It aligns with national priorities to improve service delivery, expand access to healthcare, and enhance community resilience. Under the project, approximately 10,000 community health workers are expected to be trained by 2028, with an additional 5,000 receiving advanced skills development. About 70% of the beneficiaries are expected to be young women between the ages of 18 and 35. Speaking at the launch, the Minister of Health, Dr. Louis Nkoto, underscored the broader economic and social impact of the program. She highlighted its potential to boost the Liberian economy by equipping young people, including community health assistants (CHAs), with opportunities to pursue entrepreneurship, access financing, building business skills, and benefit from mentorship and working opportunity. Also on our development, we have update from the Nima County Health Team. May 4th, 2026, the Nima County Health Team, in partnership with Samaritan Press, unveiled a newly renovated and upgraded MCCH building solely dedicated for maternal, newborn, and childcare at the Daotei Community Clinic in Sanikore Ma Health District. This unique facility features two delivery rooms, two postal and two postal wards, ACN and screening rooms, four indoor bathrooms with modern toilets, ambulance dock, waste disposal facilities, water, electricity, etc., and expected to serve a population of over 18,000 people across 17 catchment communities. The Ministry of Health remains committed to ending preventable maternal and newborn death across the country. Thank you, Angelina.
Oh, thank you very much, David, for bringing us our development updates based on this. You can also visit the Ministry's official Facebook page to get more development updates. A lot is being done by the health sector, and you can only have access to these different informations by visiting the Ministry's page and directly website. So this morning we have invited in the studio Nurse Comfort Debbie King, Deputy Director for Healthcare Quality Management Unit at the Ministry of Health, and Mrs. Precious Sako Jackson, Montserrat County Focal Person on Infection and Prevention Control. They are said this morning, as you heard from me previously, to be marked World Hand Hygiene Day, often celebrated on May 5th. And we are said this morning to bring more education and awareness on World Hand Hygiene. I mean, why it's important that we practice proper hand hygiene. So, with that said, we'll join our guests this morning to begin our discussion. So, let's begin with Nurse Comfort. Good morning.
Morning, teacher.
How are you?
Thank you for having me and my teammate, Precious. It's an honor to be here this morning as we commemorate the World Hand Hygiene Day.
So, how is the quality management unit?
Quality Management Unit is fine. On behalf of the director, Dr. Roxin Boka, who is now on the field, all hand on deck, boots on the ground. She's in the field this morning and she gave us her support to be here this morning. So the unit is well, the unit is fine, everything is going on as planned.
Okay. Mrs. Jackson, good morning.
Good morning, Angel.
It's good to have you here.
Thank you.
This is your first time
Sure.
ever here. How is Montserrat responsibility?
What Valentine is great. I'm glad to be here to represent the Montserrat County Health Team on behalf of our powerful and our energetic CHO who gave me all the authority to come and sit in this platform to represent the county health team on World Hand Hygiene Day. Thank you, Angel.
Okay. So today we are set, as we all are saying, today is Working Hygiene Day. And we are out here to educate the people this morning, the general public this morning, about the importance of proper hand hygiene. But let's first say, give a background of this word hand hygiene day, as in why it is important, what led to the establishment, what was observed, and what are the issues was established to actually address from your end. So let's begin with this comfort.
Thank you, Angel. Like you stated in your introduction, um, the Clean Hands Save Life started in 2009 by WHO. So the goal is to ensure that health workers are safe and the patients that we are serving, they are all safe. So that's the goal to prevent HAI, healthcare associated infection, um, within the healthcare facilities and to ensure that patient safety is at the peak. So that's the whole goal of the hand hygiene day, ensure that health worker and patient are safe when we all practice good hand hygiene.
So let's localize it a little bit from the broader perspective. Globally, that's the objective.
That's it.
So at the level of Liberia, what are we doing as a country to ensure that these people we are targeting when it comes to proper hand hygiene in preventing infections are adhering to these things?
So, okay, thank you for our listening audience. Let's talk about what is hand hygiene first. So, basically, it's the use of soap, water, hand sanitizer to wash your hands. So, it's the cleaning the hands to ensure that you are safe. You're not getting sick from diarrhea, cholera, and the rest of it. So, as a country, we know when Ebola strike, what happens to our whole health system. So after that, a lot of measure was put in place. So if you notice, even during the COVID, it did not catch us unaware. As health worker, as Ministry of Health, we were prepared to combat COVID-19. So in all of our health facilities, we talk about hand hygiene, ensuring that we have water and soap available. We have hand sanitizer at all point of care. So this is to ensure that everyone practice hand hygiene everywhere. Yeah.
Mr. Jackson,
Yes.
you want to add to what Ms. Comfort said?
Yes. So just to add to what Ms. Comfort just said, hand hygiene is practiced everywhere in all of our facilities because it helps to save life, prevent other sicknesses, and also it is the most cheapest way to prevent yourself from getting sick. So, like she said, hand hygiene have been practiced since the onset of Ebola because Ebola exposed our health center because we were not informed at that time. We used to practice hand hygiene, but not regularly on a daily basis. Sometimes people will make steps, but with the the situation right now in our country, we practice hand hygiene at all times before going to the patient and after touching patients. We also practice hand hygiene. We even practice hand hygiene at our various homes and community as well.
All right, so in hygiene day. So to you, Mrs. Jackson. So When do we wash our hands?
We wash our hands regularly before touching patients and after touching our patients.
So is it only basically started around clinic or nurses attending to patients?
Not exactly. Hand hygiene has been practiced everywhere. Schools, churches, mosques, and even workplaces also practice hand hygiene as well.
All right. So
So
you
before you ask your question,
okay?
just to add to what Precious said, WHO have this moment we call the WHO moment of hand hygiene. So that is a guide for all health workers, like she was saying, before patient contact, after patient contact, after aseptic procedure, before patient surrounding. So these are moments that we track as health workers. So at a community level, we tell you before you eat, you wash your hands. From the bathroom, you wash your hands. Before you give your baby ticket, you wash your hands. When the children are from playing, you ensure that they wash their hands. So that's how it's structured.
So aside today doing the awareness on the radio, is there things that the healthcare management system and advocacy for the Mosarada County Health level is doing to in making sure that community dwellers, students, or even schools are practicing hand hygiene?
Yes. So we always engage in our community. We engage schools, we engage churches, we engage mosques, we even visit offices to ensure that everyone wash their hands regularly on a daily basis. So we had an outbreak on impulse. We had a massive engagement with schools, with churches, with mosques. We even went to the various marketplaces. We created awareness on hand hygiene. We encourage people to wash their hands regularly on a daily basis because, like I said, it is the cheapest way to save you from getting sick.
Yeah. So hand hygiene is cheaper, but again, is stronger. When you take action in cleaning your hands, there are so many lives you're going to save. Like we were talking about healthcare associated infection. So just that simple thing of washing your hands, it will prevent you, the next person, and then the community. So the whole thing about it is just not based only on health worker, because the first thing is the health worker should be well before she can give care to the patient. So you ensure that you yourself are safe first. That's the first thing. Like if you are in a plane, they will tell you the first safety measure is when the oxygen stuff drop down, put it to your nose first before you can help another person. So that's the whole thing about it. You have to take the first precaution before you can save another person. So if you the health worker, you are not practicing good hand hygiene, what happens to your patient? So how can we prevent healthcare associated infection if good hand hygiene practices are not in place?
Okay. This is Jackson. When you were speaking, you mentioned that health workers should practice hand hygiene before and after. But the education we are providing here today is not limited to health workers alone.
Sure.
So we are talking to the general public, people in communities, in homes, all around Liberia. In fact, people who are listening at the international level can also learn from us. So I want us to educate them on the correct way to wash hands and how long should proper hand washing take.
So in the community, like Ms. Papa rightly said, you wash your hands before and after is our main goal to wash your hands before and after. So you also wash your hands with soap and water.
Before and after what? At
Before
community level.
in the community,
Mhm.
like when you're coming from outside, before entering your house, you wash your hands. Before eating, you wash your hands. After using the toilet, you wash your hands. And you washing your hands not just with plain water, but it's better to wash your hands with soap and water. And when you're washing your hands with soap and water, you wash your hands with soap and water for 20 to 60 seconds.
Okay, let's talk about it how because you say you soap in water.
Mhm.
And I once heard that you shouldn't use water that is set like that. You should be
No.
running water or something. Can we talk about that?
Yes. So It's not conducive to wash your hands with water that is already placed in a bucket just to put your hands in it. It's good to wash your hands with running water. So if you don't have a pump at your home that you can just open with faucet, you can place the water into the bucket and bucket with faucet, and you wash your hands properly with soap and water. That's the safest way to wash your hands. Always wash your hands with soap and water.
Yes, okay.
Yeah. Better still, you ask someone to pour the water in your hands.
Yes.
Like put it in a cup and say, "Can you pour it in my hands?" And then you put the soap and allow it to form a ladder or make it to foam, and then you perform your hand hygiene. But this is it. Water is and soap is they are the cheapest one.
Okay.
You will find it anywhere. You'll find water anywhere you can get a piece of soap anywhere. But hand sanitizer is expensive,
Okay.
but it is easily carried. You perform hand hygiene with hand sanitizer everywhere. Unless water and soap. But water and soap is the best as well.
Okay. I think you've already answered the next question.
Oh.
Because I was about to say many people have replaced hand sanitizer with washing hands. So you've already advised them to use sanitizer as well. Let's talk about the effectiveness of this. Can it replace hand washing altogether?
What, hand sanitizer?
Yes.
So there are two things. We usually say when your hands are visibly soiled, meaning you look at your hands and you can see the dirt on your hands. At this time, it's not hand sanitizer anymore. It is water and soap. But another point is that when you use the hand sanitizer, there's a crystal light that is formed like sand on your hand. When you rub the hand sanitizer, you feel like sand on your hand. At that moment, the hand sanitizer is not effective anymore. Your hands are already dirty. And at that time, you need water and soap. So, usually, we health worker will say, when we wear glove, we don't, you just take it out and put it down low. So the use of glove does not substitute hand hygiene. In simple terms, when you wear glove, you have to wash your hand. Don't say if I'm wearing glove, it is safe, I finish, and I'm just going to go no. After wearing glove, after you remove the glove, go and perform hand hygiene. So usually in a hospital, you will see even when doctors are doing rounds, when you look on the trail, you will see there are hand hygiene, hand sanitizer, alcohol hand-based rub that is there that the doctor can just go between patient and use that. So he will not touch or she will not touch the patient after touching this patient and just rush to another patient. No. The doctor will always perform hand hygiene between patients. That's the moment Precious was talking about.
Do we have anything like over washing of hands? To say if you already wash your hand, it's harmful,
So that's a myth, but no,
Okay.
it depends on what you are doing. If you are in a facility, that's your routine life because you want to prevent the spread of infection. Yeah. So you will have to do it over and over until you leave and even go home, you will have to practice that. But you notice that even like right now, you pass all around, you wouldn't even see hand hygiene buckets. Even line ministrates, you wouldn't see that. So we even want to encourage land ministrates to ensure that hand washing stations are placed at the entrance of the ministrates. Do not only wait. Oh, there is an outbreak. The everyone, oh, let us set up hand washing station. At that time, it will catch you. Someone may have already passed into your facility or into your office or whatever it is. Before you check, it has already caught you with your pants down.
She has just answered my question. I was about to ask, and she answered because I wanted to know, things happen when there's an outbreak.
Yeah.
Yes, especially on hand washing. And nowadays we don't see it. So you just answered. I wanted to ask, what are you guys or what can be put in place
Hand
to
washing
bring back?
stations.
Yeah, hand washing station because it's very important.
Yes, so that conform as they said, we shouldn't wait for outbreak before we ensure that hand washing are done to our various homes or ministry. So we should always keep our buckets with soap and water, clean water, not just water, because at times people put water into the bucket and leave it for 2 3 days. No. RPC, for standard practices, we say you should clean your water, change your water regularly on a daily basis, with soap and water to practice proper hand hygiene. So we shouldn't wait for outbreak at all times, because even at our various offices, we go, we use the bathroom and we come, we don't have water, or we go out and come back, we don't have water. Some people will just use the hand sanitizer, and as Nurse Comfort say, the hand sanitizer, when you use it regularly, you will still have to wash your hands because it's not safe. It will make your hand dirty at times. When you use it, after a few minutes, you have to get soap and water to wash your hand regularly.
Okay, I'll come back to you on the bucket with the faucet, right? You know, when buckets, some of the buckets that are stationed at offices, right? We have large quantity of, let's say, chlorine. You have to mix all of that, and if you wash your hand, you see your hand start to peel and get wet. So, is there an exact quantity? Is it advisable to add this onto the
So
water?
it's not advisable to add chlorine to your water. Just a clean water with soap is appropriate for proper hand washing.
Yeah. The chlorine solution is used during an outbreak. So it's not to be used routinely like that. So get your clean water, get your soap attached. Sometimes, sometimes back, we noticed that the detergent was placed into, let's say, tar soap, right? It was placed into the drum of water. So at that time, you just put your hand, you wash it, but the soap still remains on your hand as you go. So we say no. Don't put it in the water. Find a bottle with the soap there, you see them, or you get a bar soap, and then just get a clean drum of water, and you can use it. So we just need to keep encouraging our health worker, keep encouraging our community dwellers that it is not just about outbreak, it's a routine way of life.
So before we go back to the community level education, I want us to go to the health facility a little bit. Hand hygiene is especially important, critical at the facility level where healthcare workers, care for patients daily. Is there a standard approach they should follow? Maybe some of them have forgotten about some of these things. Let's give them the awareness, the reminder of what they are to do to prevent infection.
Okay. So we have in all of the hospitals or the health facility, we have infection prevention and control focal persons that are assigned in a hospital. So they are like watchdog. They are on the back of the health worker, ensuring that hand hygiene is not compromised. Even though we do have our own problems at times, but they are always there making sure that people are following these practices. Few years back, we celebrated World Hand Hygiene Day at the Ministry of Health. So what we did, we went to the facilities and we got champions, hand hygiene champions, and we were able to certificate them. We motivated them, gave them certificate that this is a good practice and so forth. So it's something that is ongoing, and we just need to continue to talk.
And there are some, while parents are practicing hand hygiene, some of them might be practicing hand hygiene, some of them are hearing this and maybe want to go about with it. Of course, we encourage them to do that. It is equally important that they begin to teach the children how to do the same. So for parents who haven't started, what is the best way to begin?
So okay, question.
Yeah, so for parents who have started to practice hand hygiene at home
For the children.
for the children, the best way is to keep encouraging your children. Hey, you, whenever you goes out to play, you come back, make sure you wash your hands. So they have to place water in a bucket, like I said, with soap for that child to keep washing their hands regularly. And always tell your child that whenever you go into the bathroom and coming from out of the bathroom, wash your hands. Keep thinking that our children in our African setting, once you keep telling your child something over and over, they will learn from that and practice it on a daily basis. So once you keep encouraging your children to wash their hands, you have the water placed with soap. Once that child come from playing, before they even enter the house, they will have to think about, oh, mommy say I should wash my hands before entering. And they will go and take soap and water and wash their hands. Or after toilet, they will wash their hands. Before eating, they will wash their hands. So we just, to our mothers and our community brothers out there, we just have to keep encouraging our children to wash their hands.
Yeah, definitely pressure. And you know that the hands are the medium through which infections spread. So just imagine right now how many times we have touched the decks. How many person came in here? How many person left? How many person perform hand hygiene before entering this place? How many person perform hand hygiene before going out? So opening the door, how many times everyone here touched that door? Right now, there is no hand sanitizer here. So imagine you touch your eyes, your nose, put your hands in your mouth, countless times, and no hand hygiene is being done. Sometimes we come up with diarrhea and we don't know. I mean, why I ate? I don't know why I ate. Oh, my stomach just got loose. Something was not right, even though you didn't eat anything. But that small thing, that simple thing, pressure was talking about hand hygiene that grown up a bit all by himself. That if you don't take action, like our team said, if you don't take action, you will get sick. Even the children that you're talking about, they will get sick. See how many times our children go out, play, associate with others, and then they come home and they don't perform hand hygiene, they will get sick. School health, we usually those, especially at the county level, they are always at those schools doing school health in collaboration with the unit. They do school health. We also give support. Go to the school, give health education. If you remember some time back, we had a flu outbreak. It was so much. But do you know that you could break that just by cleaning your hands and covering your nose? So many of us will sneeze like this and then swear.
The worst part is you can
Shake your hands.
In fact, if you feel uncomfortable, the thing you add too extra.
Definitely. Some people will go along the road and you know what they will do there. And then they turn around. Hi, Angel. And then we don't want to shake their hand like, what want that? You always love to ask for. No, that's just a simple thing. So there are small bottle of hand hygiene, hand sanitizer that is being sold in the market. $50, $100. I mean, just drop one in your bag.
Exactly. So raising awareness through the radio. I mean, what we are doing here now is just a one way, but it does not end here.
Not at all.
So the education should be extended community level at schools and other places that you find people, children, and all that. So let's talk about the whole communities, school, churches, and other stakeholders that you know play in ensuring that our targeted audience practice proper hand hygiene.
Like I said earlier, Angel, at the community level, the community only see hand hygiene when there is an outbreak.
We don't want them
We
to
don't
see.
want it like that.
Exactly.
Yes, we don't want it like that. We want hand hygiene to be something that you live. It should be your routine. Do not wait. I'm telling you, if Ministry of Health just say there is an the break won't end, you will see people looking for bucket in the market. Bucket prices will go up,
Exactly.
and everything will just escalate. So we are trying to talk every day, encourage people every day, get on social media, encourage people to perform hand hygiene, not just for hospital people, but for us, for our own safety as community dwellers. You run from in a community already sick, and you run to the hospital. They see health worker tell you say when you go home, be washing your hand, be doing it like that. You say, I get time for that thing. Then you will go back, it will be repeating. So we will keep talking and we will keep encouraging them as you get on your health talk. Also keep saying that as well. Thank you.
That's good. Yeah. Mrs. Jackson, you want to add it?
Yeah, so as Ms. Kumpo rightly said, our hands are the main carrier of germs. So those listening in Radio Land, those that are in the facilities, always ensure proper hand hygiene. And for those that are in the facilities, we have our RPC focal presence in every facilities. So they wash on our health workers. They ensure that hand hygiene are practiced on a daily basis, not just washing hands, but even wearing the gloves. Before wearing your gloves, you ensure to wash your hands. After going and perform procedure for that, you have to wash your hands. But many at times we make steps. People will wear gloves, we're all washing their hands. And sometimes they feel that when they wear the gloves, they don't need to wash their hands because they have no glove. So they will just remove that glove and trash it without washing their hand. But we say no. For IPC best practices, whenever you wear gloves, after removing the gloves, be sure to wash your hands with soap and water to save yourself and that of your patients and even your community at large. Because we as a health worker, once we are infected, our community will also be infected and our children.
Let's not forget about the rural communities. I mean, I know we are talking in general, I just want us to just spotlight them. The rural communities, based on the assessment as prevention, infection prevention focal person at the National County Health Center, this assessment or observation, if you have done any, how is hand hygiene being practiced at the rural community level, and what do you think needs to be improved?
So for Maserati County, we have 7 health district in Maserati. And in that 7 health district, all of those districts have IBC focal persons and EHT as well, environmental health technician. So our EHT engage the community by creating awareness. But like Nescofa say, in our community, people only sees the importance of hand washing during outbreak, and we say no. So our EHT is always in the move to go into the community along with RPC focal person in the rural area because all of our 7 health district has RPC focal person in the district. So those RPC focal persons in the district supervise the community, the facilities within the district, and also the EHT within the district engage into community awareness to keep the community dwellers, encourage them to keep their hands washing. But like I said, our community people only sees the importance of hand washing during outbreak, and it's not supposed to be like that.
Okay.
So this here.
You can add it
Okay.
because I was definitely coming to that.
All right, Angel. So at the facility level, we do an audit, hand hygiene audit.
Okay.
So wherein we use the audit, the WHO 5 women to conduct the audit. So it's like this. You are the doctor who is doing a procedure, and then the auditor, the IPC focal person, and other um, team member, they will come and then watch the procedure, what you are doing, and then they are going to be tracking at what time did you perform hand hygiene with this patient. After seeing patient pressure, what happens in between? So we track those moments for reporting purpose. So right now we are working towards having it digitized on a phone that the data can easily flow at the central level from all of the counties. So it has been like slight, but that's where we are going right now to digitize it.
So you are close to the question that I'm about to
How would
ask.
you go close to your question?
So you are close to it, but maybe there are other things you might want to add if the question is asked.
Okay.
So you are with the ministry at the not the central level. She's from Maserati County Health Team, and you are at the central level. So what is being done by the Ministry of Health to ensure that hand hygiene practices meet national and international standards? I think the two things you highlighted might fall under that. Are there other things that the Ministry of Health is doing?
Yes. So the first thing WHO has a proper core component. So one of those is to ensure that we have an IPC focal person who's going to monitor all of the infection prevention and control practices in the hospital. So at the ministry level, we were able to designate, or we have 15, 16. Maserati has 2. So Pressure has another teammate.
Okay.
So we have 16 IPC focal person at the county level. So, and then at the health facility level, we also have people that are assigned. We also have people that are assigned at the facility level. So those are the measures that at the national level we put in place. And we also do like supervision. Like me, if you go in my office, you will see one plastic towel with my strap and everything inside my slippers. So the moment I go with my haircut, I'm gone to a facility to give support. So when I even heard about the hand on deck when the minister announced that, I said, but then that's great because that's what we usually do. We go into the facility and give support. So that's one of the good things that we are working on and keep trying our best to ensure IPC is practiced everywhere.
So at this point, I think we should open the phone lines then we will have our listeners participate. So if you just join us, you are listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. We're in talks this morning with Nurse Comfort. I mean, she loves to be called that way, and Mrs. Jackson. And today marked the official commemoration of World Hand Hygiene Day. And we are providing all necessary education on proper hand hygiene this morning. So to be a part of this discussion, you can call us on 0880-514-096, 0880-514-096, 0775-677-376, 0775-677-376 at the numbers to call. Call us this morning to be a part of this discussion. I mean, when it comes to this hand hygiene, washing, a lot of us are guilty of it one way or the other. And I think this information being provided here this morning, it's giving us real pointer that we need to, reframe our thoughts and behavior around how we treat our hands because they have the ability of, causing serious harm for us, infection transmission. So call us this morning and be a part of this discussion. Ask your questions. I mean, if you also follow into the ministry's official Facebook page or ELBC Live, you can also leave your comments. We will pick them up from there. Call us on 088-0514-096, 088-0514-096, 0775-677-376 are the numbers to call. Call us this morning if you're part of this discussion. Mrs. Jackson, you were about to say something when I was talking about how poor hand hygiene causes the transmission of infection.
All right, Incha, let me hold it there. We have this call. Good morning.
Go in studio. Yes. Quickly to the point, this is Fanny from the community. Now we are observing this day. It is good. But man,
Sorry we lost that call. So, Mrs. Jackson.
You can call us back 088-0514-096, 0775-677-376 are the numbers to call. Call us and be a part of this discussion this morning. So we also have online followers. They do a lot of people following. So we can read out some of the feedback on our followers are giving while we wait for more calls. So we have someone here, Scarborough, say baby girls. And Charles is saying well done.
Wow.
Thank you.
Ernest is saying following. Did not say where he's following from.
Yeah.
And then we have Wubu Sumu Sona. Thanks for the presentation, colleagues. It's truly educational. Thank you.
Thank you.
Eric Kamara says thanks for sharing. And a lot more reactions from the online angle here. So Billy, let's take
Okay,
more calls.
we have this call. Good morning. Good morning.
Oh, wow.
What's going on? 088-0514-096, 088-0514-096, 0775-677-376, 0775-677-376 are the numbers to call. Call us this morning if you're part of this discussion. We are here talking proper hand hygiene. What is it that you want to understand about hand hygiene? what is it that you're concerned about? Call us 08805140960 07756777376 are the numbers to call. I will wait for more calls, so let's go back to our guest. Nurse Comfort.
Yes, so I just want to appreciate the Minister of Health.
Okay.
You know, hand hygiene practice cannot be performed if there is no water. So that's one of the key things that you must have. At the Ministry of Health, all of our hand washing stations, there is not a day we will run, even if we run out of water a few minutes before the day ends, you will always have a backup. So at the Ministry of Health, soap is there, water is available, and we want to appreciate her for ensuring that these things are available. When you go in our bathroom, you use our bathroom, touch the faucet, water is going to sparkle. So we want to applaud our Iron Lady for that.
Yeah, we also appreciate her for that kind of leadership
Yeah.
that she exhibits. But you're talking about at the ministry. At the ministry, you always see hand washing stations and all of that. But remember, we have 50 counties,
Mm-hmm.
right? So what are we doing at those different facilities?
We have water available. So we have partners that are helping the Ministry of Health to ensure that water supplies are available in all of the facilities. Even if you don't have running water, you will have hand pump, built by some of our partners or ministry itself. We will have hand hygiene stations there. So even if you don't have running water, you have hand pumps. Even if you don't have hand pumps, you have a well that is available. So things are improving gradually. Our goal is to ensure that we have running water.
With all that's being done by the Ministry of Health, do we still have myths apart from the over washing hand? Do we still have myth or other behaviors that's affecting the work that we do? Because there are challenges in everything that we do. Let's highlight some of the challenges.
Can you take that, Brenda?
Yes. So some of the challenges is that lack of adherence.
Okay.
Yes, lack of adherence. People know at times that once you from the latrine, it was in the community now. Once you from the latrine, you're supposed to wash your hands. But then they will not adhere to that. They will just maybe use the latrine, walk away. Then let's take for example our health facilities, like I said with glove. Many at times people will use glove and don't wash their hands. So that's some of the challenges we face in the health sectors. Mm. That is inadherence, lack of adherence. Yes.
Yes,
Yeah.
so
Okay.
I can add up to what Pressure is saying. Like we are colleagues, right? And then you find out that I am the infection prevention and control focal person, but being familiar with Benu. Oh, Benu, you pass here, you did not perform here. I say, oh, go for leave me alone. Oh, you get, I just finished washing my hair in front of my house. But you know that you wrote that say, you know the chain of transmission from one person to another. Now, when that chain is not broken, what happens is infection is going to spread. So you hear, if I don't perform hand hygiene, I come here and touch pressure, I touch Benu. Benu is going to touch pressure. Without performing hand hygiene, that's how the germs spread. That's how people get sick.
At the hand washing stations, are we the challenges as
A
well?
lot.
What are some?
That's one I just said. Adherence, pressure
Adherence.
thing. So people feel familiar with this bucket. So you look at what one water again. I won't wash my hand. People pass. But like it is something small, but it is cost. It saves lives. Just that small thing that you're talking about. When you just do it, there are so many things. There are avoidable harm, avoidable, just by performing hand hygiene. Something that's supposed to cause so much outbreak. Do you know this can cause an outbreak? Yes, because if something happens, somebody got diarrhea, and then you took care of them. without performing hand hygiene, what happens? That's how you start to spread it. Before you look, the whole room, everybody sick. Before you look, another room.
So you already say diarrhea. So can we highlight some conditions that people are likely to come down with due to poor hand hygiene?
Yeah, diarrhea, respiratory
Respiratory
hygiene, respiratory symptoms, meaning you get cough, you sneezing, you will have that. So cholera as well, water and other things. Yeah, poor hygiene practices.
So there are certain conditions that we have certain group of people more vulnerable to. And I will go back to children, maybe below the ages 5, 5 and downwards. And these people we should be able to give them some level of attention when it comes to preventing certain conditions. So how is the Ministry of Health working along with, let's say, the Ministry of Education to ensure that we have hand washing stations at various schools? I know you talk about the community aspect of it, but at various schools,
We
so
have
that
school health.
children, okay,
We have school health at the Ministry of Health. We have a focal person there in the family health unit. There's a focal person there that is responsible for school health. And I think at the county level, someone is also responsible, pressure, right,
Yeah,
for
help
school
promotion.
health. So they are all working together to ensure, and we also work along with them.
okay.
Yeah, we work as a team, especially going out. Yeah, once they call upon us, we are all working together.
Okay, so we are pressed against time. We have 9:54, just few more minutes to go. So
So let me just read this comment from our followers that are watching. This is from Chuchu Kimbo. He's following from Buchanan. Quickly, are hand washing stations still compulsory in all public places? And one for Shelley Bali Saki family. Way to go, team. Comfort King, Bai, and Precious Sako Jackson. Great job.
Thank you, Shirley.
So, Chuchu has a concern here. So,
Okay, again, please take Chuchu concern again.
are hand washing stations still compulsory in all public places?
We say yes, Chuchu. Thank you so much. We started earlier on, probably you just joining. So yes, hand hygiene station should be placed everywhere. It should be something that is being practiced as your routine way of life. So we shouldn't wait for an outbreak before we all rush to pour bucket in front of our houses, to pour soap. Let's ensure that we have these things available. I'm telling you, the moment an outbreak cease, before you look, everybody pack their bucket. They carry it inside. People start using it for different things. So it shouldn't be that way. Ensure that you have these things available at all times. Thank you.
yeah, so like I stated previously, we are pressed against time, so we use the remaining time to just give parting comments and then we can close for today. So let's begin with you, Nurse Comfort. You love to be called.
I love to be called Nurse
That's our
Comfort.
position.
Yes, that's it. So thank you so much for having us, and we want to appreciate our minister for the opportunity to be here today. It's an honor. And to my boss, Dr. Roxanne Boga, I want to say thank you so much for affording us the opportunity to be here. And there are more to come. You can count on us whenever you need anything from our office. We'll always be available. Don't forget, clean hands save life. Once your hands are clean, you'll be able to save others. As a health worker, let's practice the WHO 5 movement of hand hygiene. Every time you are not just saving the patient, you are saving yourself. Clean hand, save lives. Thank you.
Mrs. Jackson.
Thank you, Angels, for having us in studio today. So at this time, I just want to say thank you to our able Minister of Health, Dr. Louis Mpoto, and to my able energetic CHO, Dr. Joel Tapefkodi, and thank you to my director, Dr. Boka, my deputy director, Dr. Comfort, for inviting me. Nice Comfort. I'm sorry. Nice Comfort for inviting me in studio today. I just want to say thank you to the entire team. So keep clean hands, save life. Thank you.
Happy World Hygiene Day.
Okay, you care to re-echo the listeners were helpful.
Yes. Action saves lives. When you clean your hands, you will save so many lives. Hand hygiene is the best. Wash your hands with soap and water, even in the hospital, at home, in your offices, in schools, in the community, everywhere you find yourself, wash your hands every time.
Okay, thank you very much. Clean hands save lives, and it's always important to keep your hands clean. With that, this is how we like to leave you on today's edition of the program Road's Way to Health. Many thanks to our guests for sharing such valuable insights. We have been your host this morning, Angel Noah, and
Yeah, no, darling.
AB Salif has been here also taking us live. Until next Tuesday, have a good day.
Thank you. Bye bye.
Thank you.